Hi, everyone. Thanks again for joining us today for our webinar, New and Efficient Patient Engagement Solutions from Ocean. We will be muting this webinar today, so if you do have any questions throughout the conference, please feel free to ask them in the Q&A section, and we'll do our best to get to them before we finish up. To ask a question, select the chat button center of the icons on your screen, and then when asking questions, ensure that you select to send to all panelists. I'm very excited to introduce you to Victoria and the Ocean team. For those not familiar with Ocean, they are a telehealth partner offering low-cost EMR add-ons such as online booking, patient forms, and check-in kiosks. Over to you, Victoria.
Great. Thank you so much, Patrick. And thank you to everybody who dialed in today for taking the time to learn a bit more about where we're at with the Ocean platform. I was looking at some of the names that have been dialing in as you've been signing in, and it's definitely a big mix. I know a lot of you personally, I know a lot of you as clients, and there's a number of you who I think are not yet using the Ocean, so a real range of users listening to us today. I'm going to give you a bit of a heads up about what to expect. So I'm going to introduce myself first of all. My name is Victoria Badgley, and I work here with the marketing, sales, and biz dev side of things. And I'm also introducing my colleague, Dr. Doug Kavanaugh, the co-founder and medical director here at Cognizant MD, who will be handling the live demo portion of today's presentation.
Hi, everyone.
To make sure everybody's up to speed on what the Ocean platform looks like today, because it really has evolved over the last 6 years. We're constantly adding features and even products. And so it's a much broader product suite than it was a few years ago. And even for some of our existing users, I think you're going to learn a few things today, possibly even about solutions that you're already using. So we'll cover off an overview of the platform. We'll talk a bit about some of our differentiators, why clinics are using Ocean and how, what the benefits are there. We'll briefly touch on a few of the highlights that you're going to see in the live demo portion. And then I'll pass it over, as I said, to Dr. Kavanaugh and Adam to show you what it looks like. We will wrap all of this up with a quick overview of what pricing looks like, and then we'll do, hopefully have plenty of time to do a bit of a Q&A. So yeah, people are have varying knowledge and background with Ocean and Cognizant MD, but I'll just start by giving you a little bit of background. So we are a 6-year-old company now. We started here in Ontario and remain based in Ontario. Our team started 6 years ago, as I said, and launched in September of 2013 with a couple of clinics here in Ontario using Practice Solutions. Since that time, we've grown and expanded from what was initially really a tablet solution that allowed patients to enter information that could then flow into their EMR. And we've evolved into what we see as really a full-fledged, comprehensive patient engagement platform. Not only is it a patient engagement platform, but we have also expanded into other parts of digital health, most specifically around e-referrals. But the talk today will focus on MedAccess and the patient engagement tools that you can take advantage of. So today, when you look at our scope, we are in 7 provinces actively with over 4,000 clinicians using our technology, and over 10,000 forms are completed every day by patients who are entering information right into their own chart. So let's talk a little bit about what the Ocean platform looks like. To understand Ocean, you really first have to start with forms. So not only does Ocean come with a library of literally thousands of patient-facing forms, administrative and clinical, some with built-in scoring or red flags, some that will just complete a history. There's really a full range of forms that sit in the library. And that's what one of the huge advantages that you get with Ocean is as soon as you turn it on, you have access to this common source of content that really is unique, we think, in North America. And all of that content is editable. But we take it a step further and we use that forms engine and that approach to building forms to power every single one of our solutions that sits on top of it. So whether it's a tablet or whether it's an email reminder, forms are playing a role. And what that means is you can be engaging with and collecting data from your patients at virtually every step of the journey using digital tools with those forms underlying. So when we take a look and take a step back and say, where is Ocean touching our patients throughout that patient journey, it really is turnkey. From before the visit, whether that's going to your website and completing a form openly available on your website, whether they're booking online from a clinic website, or whether they're receiving a reminder automatically about their appointment that incorporates a form that you may want them to complete ahead of that appointment. So forms are optional and appointment reminders are highly, highly customizable. When they arrive at the clinic, once again, they're faced with the check-in kiosk, which may or may incorporate various forms based on the reason for visit, and then patient tablets, which is really where Ocean started. They may be used in the exam room or handheld in your waiting room, many, many uses for the patient tablets. And then finally, after a visit, we can set up automated messages to go out to the patient, whether that's to collect a patient-reported outcome or to better understand how your patient's experience was, and that can be tracked both in the chart and in our studies database if you so choose. So it really is one platform that meets, from our perspective, really all the clinic's patient engagement needs. So how's it helping and how's it being used? We are always talking with our clinics. We pride ourselves on having very active support channel, and we're really always listening to our clinics and the users. That is really how Ocean has evolved to the place it is today, is through feedback from those users. But today, I've pulled out 4 of the things that we hear really commonly and that we think are sort of really kind of game changers and also quite different from some of the other digital health tools on the market. So to start with, again and again, we hear clinics tell us that Ocean is helping to save our admin staff time, whether that's through simplifying patient intake by allowing patients to complete those forms completely digitally before they even walk in the clinic in an automated way and have that flow straight into the chart, which Adam and Doug will show you, or whether it means taking fewer phone calls because patients can book for themselves online. At the point of check-in, allowing patients to both not only check in and change their status in the schedule, but also to update their demographics and have that flow right into the chart without having to ask, are you still at this address? All of those values, saving admin's time. So that's step 1. Step 2, and this is one that people don't always think about when they're thinking about patient engagement tools, but Ocean is being used more and more to both build and then automate quality improvement and screening programs. So we see those programs replicated over and over again. So whether you are looking to start collecting patient-reported experience measures or patient-reported outcome measures, smoking screening is a huge one. So automating smoking screening across your patient population so that you understand that and can then act upon it. Or flu shot screening, which can be done seasonally based on rules or based on risk factors. So lots of automated programs that Ocean is enabling. Thirdly, charting. So I think this really speaks to, and Doug can talk to this more, but this was partly, I think, the driver for Ocean in the early days to help clinicians and make their life easier while getting better data from our patients. So by allowing physicians, healthcare providers to collect a full patient history before their appointment, allowing them to calculate the scores in the background automatically, so there's no manual scoring, no scanning of forms, PHQ-9's done in real time, and you can see that score and what it means, or whether you're using it to auto-generate consult letters. So we see specialists taking that input from Ocean and letting that generate almost a comprehensive consult letter ready to go that they just need to make small tweaks to. And all that means that doctors and physicians, healthcare workers are going home at the end of the day and not staying trying to catch up on their charting. So faster, more complete, better experience for the clinician. And finally, of course, really the reason why we all do what we do, improving patient care and the patient experience. And we uniquely do that by enabling patients to directly contribute to their care, directly contribute to their chart. We also are giving patients more ways to communicate their concerns. And what we see is that does lead to better care. So mental health is a really great example, whether it's asking somebody to report their concerns on a tablet versus in a personal interview. We see in studies time and time again, you get different answers. And so what that means is by doing both, you can absolutely provide better care and have a better understanding of your patient's concerns. And of course, fewer no-shows. By making it easy for your patients to book, by automating those reminders, no passwords. That's one of the things we love about the Ocean system. We're not asking our patients to set up an account and remember a password. So no calls to your team asking, how do I reset my password? It's all done with simple validation, totally secure, but doesn't require them to have that dedicated password. So that leads to fewer no-shows, which is better for the patient ultimately, and a better, easier booking experience for the patient as well. So it's a win-win-win. So I'm about to pass it off to my colleagues, and they're going to show you what all this looks like. But keep an eye out for a couple of things. So they're going to walk you through what online booking looks like and show you briefly what a website form could look like, show you how all that works. Again, remember, no passwords, no logins. Huge advantage with Ocean. Patient reminders will show you what a patient would experience, what it looks like to them when they get their customized message to remind them about their appointment, and potentially incorporate a form that's specific to that appointment. We'll see what it looks like when a patient checks in at a kiosk, automating and streamlining that process, and potentially showing or illustrating some specific clinic announcements. That will tie directly into the tablet discussion because kiosks and tablets are really two parts of the same solution. And then finally, they'll touch on Ocean studies and how you can collect data using Ocean to collect data for research or survey purposes in aggregate, and either have that flow into the chart at the same time or simply collect it for survey reasons. So I'm going to stop talking now because the reason you're here really is to see it. So I'm passing this over to and introducing my colleagues Adam Lanyon and Dr. Doug Kavanaugh.
Thanks, Victoria. We're going to start with a product called Website Forms, which allow you to take any form in the Ocean library or possibly one of your own forms and embed it on your website very easily. Website forms can be used for all sorts of different purposes for your clinic. They provide a really convenient way for patients to contact the clinic independent of traditional methods like using the phone or leaving a voicemail. They're completely secure, but they don't require any sort of login or password on the patient's part. So they're ideal, for example, for new patient registration or for, in the example of my clinic, a wait list registration system, appointment cancellation requests, you name it. It really can be used for any type of request. So I'm going to let Adam demonstrate a typical family practice website and how website forms can integrate with it.
Sure, thanks, Doug. So as a patient arrives at this particular questionnaire, it's designed to capture all of the patient's contact details, so that way we have a proper way of identifying this patient with an existing patient chart in the EMR, or it'll help us create a new patient registration and a new chart in MedAccess once complete. All of the patient questionnaires, the questions that are captured by the questionnaire go into MedAccess, so that way you have a process to review this information, ensure that this is a legitimate patient request, and accept and download this information into an existing chart in the EMR, updating any demographics and keeping all of those secure patient responses back in the chart where you're normally going to be looking for them.
Okay, next we'll start talking about a variation of a website form, a very special one online booking. So with online booking, you can provide real-time access to your clinic schedule or schedules. These schedules can be configured to show under different circumstances. So for example, you can have your nurse's schedule show when a patient requests an immunization, or a physician's schedule to show when his or her own patient requests a particular appointment. Now, these appointments are booked in real time, so available slots based on how you see them in MedAccess are shown, and block slots are appropriately not shown. It works on a mobile device. Like our other website forms, patients don't need to worry about registering for an account. There's no login or password required. And really, whether they're accessing it on their home computer with an old Internet Explorer browser or their iPhone, it will just work for them. In my own clinic, I've had a number of great reviews since it launched earlier last year for me. Patients love it. Our front desk loves it because it's taken the load off the phone and the front desk in general.
So I'm going to walk you through an example of a patient coming in to create an appointment, and we've configured our online booking form to only accept registered patients within the EMR. So as I hit yes, that I am a registered patient, you'll notice I don't have to create a password or manage an account. My patient is just entering in their normal contact information, things that they should know off by hand, their health card, and their date of birth. Now,
if I can interject, this is the more common flow, but patients can optionally, if your clinic wants to allow this, book for the first time if you're running a walk-in clinic, for example. So an existing chart needn't exist. If you'd rather run your schedule that way, you can.
So now we're getting a list of configurable visit types. Why is the patient here? Why do they want to come in for an appointment? This list is clinic defined, so you get to set as many options as you wish. And as you'll notice, you can also assign and advertise a specific visit duration, so that way the patient knows how long they're going to be booked for their appointment, and this duration will flow into your visit schedule. Now, our patient here, we're going to book with a mental health appointment, and we're also going to ensure that this patient goes through an OCEAN questionnaire as part of this process, specifically keying in the PHQ-9 as part of our online booking. Next, our patient goes through and is able to see the list of available providers. Again, this is clinic configurable, so we've assigned a list of providers that our patient is available to see. And now that the schedule is loaded for our provider, you'll be able to see a list of available dates in green bold text, so that way I can select the most appropriate appointment. Now you can also set the number of days in advance that a patient could book for. So maybe you only allow the next 14 days or another range of visit dates in the future. This way patients might not be able to book 6 months in advance when your physicians might be planning to go on vacation ahead of time. Now, all of these visit times that you're seeing here are a list of available date times in real time. So that way the patient can update and select the most appropriate appointment and update that schedule in MedAccess. So let's go ahead and book this appointment for October 30th. We've got 9 a.m. selected there. And we're now communicating back with MedAccess to send that confirmation back into the system. We've been able to book our appointment now. That was pretty fast. And the patient's able to view all of their details. Now, the patient has the ability to send a confirmation note back to themselves, so they can plug in their email address. This could be in a case where the patient has not provided email consent in the past, so now they're just driving this response to themselves. Up above, you'll also notice there's an Add to My Calendar option, so that way if the patient uses a calendar tool, that can create the appointment in their event schedule. Down at the bottom here, you'll also notice that here's the PHQ-9, the OCEAN form that we mentioned. We're going to go through and complete this so that way our physician has as much information about the patient's current state when they're booking the appointment, so it's available in the system for us to review.
So just to clarify here, this is an example of a post-booking form. So it's an opportunity to collect more information up front based on the appointment type that was selected when they initially requested the appointment. So they chose mental health, and thus we've configured Ocean to show a PHQ-9, the popular depression screening tool, in that circumstance. So this is an example of a way that Ocean can assist with not just the booking process, but the history taking. And you can set this up so that, for example, the nurse's schedule or some other allied health professional's schedule appears based on that visit type as well. So an immunization would show the nurse's schedule and could perhaps clarify which immunization is requested from the patient.
Right. So now that we've finished the experience here on the patient side, we get a confirmation that the answers are successfully saved and are going to transmit back into MedAccess. And let's now transition over to MedAccess where we can see that visit in the schedule. So that was for October 30th. If we just quickly refresh the schedule, there's Holly. She's got the appointment there for 9 o'clock. We've got the mental health visit type. Everything's flown in just as we need. So now let's dive into Ocean Reminders.
Great, Adam. So Ocean Reminders are another product from Ocean that can automate your schedule by looking at particular appointments and based on the nature of that appointment, send a customizable reminder to the patient. And that reminder is an email with an optional link to some forms that provide another opportunity for you to collect information up front. Now, these reminder rules, as we'll explain in further detail soon, can be configured in all sorts of different ways in advance of the visit and based on the type of the visit. So you can have reminders, for example, of one type that's sent to your patients coming in for diabetes visits and another set of reminders for your patients coming in for an initial specialist consultation. It's really up to you how many you want to create, how you want to program it, and which forms you want to include with each type of reminder. So Adam here is going to demonstrate how it works and what they look like when patients receive them.
Sure. So continuing with our no portal solution here, the patient's able to click on a hyperlink and validate their identity using their date of birth or another security method like their health card to access any sort of PHI that we're sending them. There we go. So now that the patient's been able to properly identify their date of birth, we're able to show them that they've confirmed their appointment. They've got the visit date, the visit time there as well. And behind the next button is a list of available questionnaires that we've layered into this patient experience. So here we've got the GAD-7 as part of this patient questionnaire. Patients can complete this questionnaire at their leisure through whatever method that they're accessing their email. As Doug mentioned, it's mobile friendly. So that way the patient can get this information back into MedAccess as soon as they've finished with their patient email.
Now, Ocean's very intelligent here, so it can be programmed to ask this present this questionnaire again if it was a missed opportunity during the online booking. So you can configure these reminders as a sort of second tier to ensure that if you didn't get it at the time of the original booking, you can have it as part of the email reminder process, possibly another reminder, a kiosk, a tablet, you name it. So there are many, many different ways you can collect this information with our platform.
So one other thing to keep a note of is that this is an unlimited messaging tool. So clinics can create as many reminders as they need to. Scheduling something maybe 14 days out, 7 days out, and then 48 hours. You can send as many emails as you wish to try and cut down on those no-shows, giving the patient the opportunity to confirm their appointment, complete any questionnaires that are outstanding ahead of their upcoming appointment. So now that we've got a patient that has completed a reminder for a future visit, Ocean can also be used to follow up on a previous visit. So as I open up this message here for a patient, there is a way to send a post-visit notification. Perhaps you're collecting patient experience survey data through an Ocean study. This Ocean form could be administered through a reminder as well, scheduled to go off a number of days after a scheduled appointment, and that way anonymously collect any sort of responses about how the patient's experience was at the clinic.
So this can be used, of course, for patient experience surveys, and you can design your own if you like, or take advantage of one of our stock questionnaires. But it can also be used for any other sort of follow-up questionnaire. For mental health, again, you could have a PHQ-9 send after the visit, after some specified delay. So now we're going to demonstrate what might happen next. So after the reminder, if we fast forward to the actual day of the visit, you can imagine somebody arriving in the clinic and looking to the front desk and finding that perhaps there's quite a lineup. Maybe it's a very busy clinic, or maybe the receptionist had to step away for a moment to assist with a chaperone. This is a great introduction for our next product, the Ocean Kiosk. The kiosk is a variant of our tablet. It's essentially our tablet set up slightly differently, encased within specialized, really slick-looking kiosk hardware. And it can be deployed as part of a floor model, a stand-up model, or a countertop model. It's up to you. The kiosk can be deployed in any sort of clinic as a sort of backup for the receptionist. But it can do much more than that. It can implement quality improvement programs, waiting room screening instruments, and so on. So I'm going to let Adam demonstrate how a kiosk can work, and then we can explain in further detail all the different ways you can configure this wonderful device.
Thanks, Doug. So now I'll show you this kiosk check-in. The patient can enter in their health card number on the number pad here if they have a scheduled appointment for today. Now, depending on the province, if you do have magnetic health cards, the patient could swipe their health card and do a check-in. What we're seeing here is a configurable workflow to give the clinic a customized welcome screen. So that way we can advertise what's going on at the clinic or any kind of information that we want to show to the patient. We also have a two-factor authentication here, so that way the patient can unlock any sort of PHI we're showing them with their date of birth at the bottom here. Now, Tobias might be a relatively new patient, so we can go through a demographic review here. The kiosk can take in demographic updates, so that way if we have an outstanding address or the patient wants to change their contact details, we can identify those details here. Now, if the patient does have an existing postal code, phone number, or other options, the patient could change those options so MedAccess is keeping everything up to date. And ideally, depending on what you want to show, this is just a short list of demographic fields. Other options are available. I just like to keep things short and sweet for my patients to have an easier check-in. Next on the screen, we'll be able to take a patient through a customized workflow of consent forms and other details I want to advertise about the patient. This could be an anniversary appointment. Tobias is coming back in. Maybe it's been a year later, and I want to gather consent from him. So normally, not every patient would see this on a day-to-day basis, but I can program my kiosk to reload these types of consent forms on a certain anniversary, whether that's 30 days, 60 days, or any kind of rotation after that. And I'll just collect an electronic consent statement from the patient on that, track it in MedAccess as a new progress note. Similarly, Ocean could also passively check for email consent in a similar process. In this example, I could do it once a year, making sure that I have email consent so I have updated and accurate contact information to provide to use with my Ocean reminders.
There are so many possibilities here, Adam. Smoking cessation is one that comes to mind. There are a number of family health networks or teams who have deployed a quality improvement initiative using the kiosk and or the tablet to ask patients about their smoking status and even optionally invite them to participate in a regional smoking cessation program. Other teams have used it for Ebola screening, for example, during the scare we had a few years back. And flu season, of course. So it can actually intelligently query patients for their status of the flu shot. It can ask whether they've had a flu shot, and if so, when did they have it, where did they have it. If they haven't, it invites them to receive one today. So this makes it much, much easier for your clinics to achieve your targets for flu shot immunization rates. You can even program it to show other forms. And you can, in fact, if you prefer, have patients complete it on the tablet instead of a kiosk. And in all of these rules are configurable for your clinic, and they can key in on a large variety of clinical criteria to ensure that the forms are shown when appropriate, but not otherwise.
So now that the patient has checked in, we can now return to MedAccess and see the new status. As you can see, Tobias has been updated in MedAccess. And if I click on his name there and go into the tasks, any of those consent forms that the patient has loaded has been updated as a new progress note. There we can see the general clinic policies and some of the other content here. All of the contact information, previous secure messaging that may have gone on with this patient has also been entered in. We can see the Ocean username, so that way we can clearly identify who wrote this note and differentiate an Ocean note from another practitioner note. And on the right-hand side there, we've also built in a customized widget to show the email consent status. So when a patient does update and provide their status, valid or not, we have that clearly visible in the toolbar on the side there. So I want to take a short opportunity to take you into the Ocean portal and show you there is a workflow that I've been asked about sometimes when a patient doesn't have a scheduled appointment or there is a need to communicate with the patient outside of an appointment reminder. So Ocean is an unlimited tool, and you can use the Ocean portal to access patient details and send them a message. Now, at this time, we don't have contextual launch, so clinics are able to access this simply through logging in through another tab on their web browser. And that way you can simply get to the day sheet, select the patient that you want to message, and use the handy email patient option on the right-hand side here. Now, the clinic's email template will automatically load, but I've previously scripted a number of commonly used email templates in this drop-down menu up top here. This way, for any sort of common message that I want to send to my patient, it becomes a two-click process. I can do some manual updates if I really need to, but all of the other options like form inclusion, scripting of my message has already been done ahead of time, so I can just hit send and deliver that message to my patient. Now, another setting, once that I've got that confirmation has gone out, if I go to find patients along the side, I can also look for patients that might be overdue from responding to a reminder or a Ocean message that has been sent. So here, a message previously went out to Nathan. We can see that the status is overdue, and I can see what forms are outstanding. Now, this could come in as an email notification to me as well, but the Ocean portal is a handy way to see all of the patients that might be outstanding outside of an email notification. So that concludes the Ocean MedAccess demo and what we wanted to show off today. I'll hand it back to Victoria to take us through a list of pricing updates.
Great. So thanks, Adam. So we definitely did not show you everything. And in fact, what you really missed out on seeing, but it takes a much more in-depth demo, is to really get down into the Ocean portal where all the magic happens, all the configuration. So I certainly encourage you, if you've got interest, to set up a follow-up demo so we can show you where all that setup happens and how you can really make it work for your clinic. But the first question that everybody wants to know always is how much is it going to cost me? So we've broken out our pricing here into sort of categories. So we tried to keep it simple, but as we added products, it's a bit of a longer list than it used to be. Having said that, whether it's a tablet license, a license for a tablet being used in a kiosk, or a website form link on your website, that's going to be $55 a month. So when we talk about a website form, in this case, we are not talking about an online booking form. We are talking about a website form, which is any Ocean form that you're making available for patients to complete independently online. So $55 a month per link or per license for a tablet or kiosk. And that sequential, you can add or remove services as you like. It's always pay as you go, no minimums, no contracts or commitments. So that allows you to adjust as your needs may grow or things change. So that's our pretty simple pricing plan. Ocean Studies is also quite simple. So if you're collecting data in aggregate for surveys or research, you can enable that $100 a month unlimited studies license. And we see some clinics that only do that for a few months of the year. Say they're just collecting patient experience surveys for a few months and then they turn it off again. And that's absolutely within your rights. But again, unlimited completions, unlimited studies is included with that. When we start talking about patient messages, there's really two ways of accessing Ocean patient messages. And what patient messages are is a way to send a form to a patient to complete from home. So if you just want to send one-by-one patient messages to your patients, you can certainly sign up for the $30 a month plan, which gives you one single user plus a delegate license. It's important to know that when we're dealing with MedAccess, that messaging is happening in the Ocean portal. So you would be flipping tabs into Ocean and sending the message from there rather than directly in the chart. Having said that, all messages are in real time tracked in the chart, so you always have a record of them without doing any additional work. Patients can also respond to those. So $30 a month if you want a single user plus a license. If you want a broader, what we call our unlimited clinic bundle for patient messages, that's going to give you patient messages for everybody in the clinic, group messages, which some other products refer to as broadcasting, so sending a single message to a cohort or group of patients, as well as the reminders, which you saw today. That is priced per FTE. So the best thing to get pricing for your clinic is to talk to us. Let us know what your breakdown looks like, and we can work out what that FTE full cost is, but it's a $100 clinic minimum, and assume that it's about $25 per FTE, full-time provider, and we look at physicians and, well, really anybody with a schedule who runs their own schedule. So best to talk to us to get a quote on that. And then finally, online booking. So if you wanted to add online booking, it does require that you have that unlimited clinic bundle. So the clinic has to already have that in place, and at that point you can then add, as you like, you can add schedules to online booking for $25 per month. So we bill that on a per schedule basis. It doesn't require that all of your FTEs engage, because that's not how we're seeing online booking roll out. We're seeing clinics start with 1 or 2 schedules a month and then grow from there. So that's what the pricing looks like, but again, we encourage you to talk to us because sometimes there are nuances, and always best to get a full understanding from us directly. If you do want to look back on this, we always show our pricing. We are always transparent about how much our pricing is, and so you can find that on our website, which is at the top, cognizantmd.com/pricing. And that will always give you the most up-to-date pricing, not that it gets changed. So I think that covers off on the pricing side of things. But I do want to jump into a couple of questions, and please encourage you. It is, we did go longer than we were anticipating, but we still have 11 minutes left on the clock. So we'll answer the questions that we have, and if you have any more, please don't hesitate to enter them in the box available. So we were asked, is the price per clinic or per doctor? So it really depends on which, maybe we can jump back to that pricing. So when everything is per clinic, with the exception of those 2 patient messages and the online booking. So online booking, again, we're looking at what schedule do you want to expose. So that's going to be per schedule. If you're looking at patient messages, that's per user plus delegate. So we see some clinics who choose to have a patient message license and they have 2 admins using it. And that's at the $30 a month. And then when you're talking about the bundle, you can assume, do your math, around $25 per FTE. We don't charge for admins in that model. So we're looking at full-time providers, but just remember that that has a $100 clinic minimum. So hopefully that answers that question. We were also asked about health card swipe earlier. So is there a health card swipe in BC for the kiosk check-in?
Yeah, I'll jump in on that one. So if a patient has a magnetic health card within BC, doesn't matter the version, Ocean will be able to take that check-in through the swipe.
Great. And another question around reminders. Can you have more than one reminder for the same patient? And what if they don't complete their form?
So Ocean is an unlimited platform, so you can create multiple rules to go out for the same appointment, perhaps 7 days out, 5 days out, the day before the appointment. If your initial email includes an Ocean questionnaire, any Ocean interaction that the patient has, maybe on the second appointment reminder or on the last one, any queued forms that have been sent will be available for that patient to complete. And that's also why those forms are available on a tablet in the clinic if the patient doesn't do it in from the online system.
Great. Looks like I've got one more question here around reminders. Actually, two more, sorry. So one around SMS support for sending reminders.
So currently, Ocean is just based on an email tool. So if the patient has an email, they'll be able to receive that reminder. But in 2020, in the first 2 quarters, we're looking at releasing an SMS text message version for reminders.
Great. Okay, I've got 2 more things to cover here. We did get a question about whether or not data elements can be coded with clinical terminology, things like SNOMED, and the answer is yes, through the customized form. So you would just do that on the form end. But I've got a question here around the request for an appointment, and so this clinic is trying to understand, when you book online, is it a request for an appointment or is it an actual booked appointment, and do they get a chance to review? Do they have to approve it?
So this is the real deal, the online booking, where the appointment goes directly into the slot, but only if the slot is available. So it's a real-time read and write of your appointment schedule. And it's quite robust that way. So there are many checks in place to ensure that there are no double bookings, for example, or at least the risk of that is extremely low. It is something that's amenable to a review process. Most clinics, I find, sort of do that in an ad hoc manner, where they just look at their schedule and note that certain appointments have been booked online. So we make that clear, which ones have been booked online and which ones have been booked manually, which you can do at the same time if you like. But we also do have a review workflow too, where if you really want to have a close look at each individual online booking, you can do that within the Ocean portal as well, and make adjustments as needed.
And finally, a question around secure messaging. Is there secure messaging with the patient? And the answer is absolutely yes. Within this window of time, it's really difficult to show you absolutely everything that Ocean can do. So we'd love to show you how secure messaging does work, but absolutely you can message with a patient directly. You can send them additional forms. You can add attachments. So all of that is possible within Ocean. Currently, there is what we call not a contextual launch. So you can't click a link from the patient's chart to open the window, but what you can do, given that MedAccess fortunately is a browser-based EMR, you can switch tabs and it'll be right in front of you to send the message from Ocean. But second to that, I just wanted to mention that we hear from TELUS that we are getting contextual launch, and so we are waiting on that and super excited. And once we get there, it really will be on par with what we're seeing with our other EMR integrations. And I can tell you secure messaging is a really, really highly regarded. It's one of the tools our clinics absolutely love. So keep an eye for that contextual launch announcement, hopefully soon.
Yeah, the great thing about secure messaging with Ocean is you're in the driver's seat still. So it's not an open access portal where patients could submit whatever questions they want. You can send a secure message and choose whether they can reply or not. So it's excellent for delivering lab results or test results or FYI type messages, appointment information from specialists, that sort of thing. The complement, of course, just like everything in Ocean, is the forms engine. So if you want patients to be able to initiate requests, then it's quite easy to set up a website form, which has the added advantage of having close-ended questions if you so choose.
For example, if you want to accept prescription renewals on your website or general clinical questions, then you can set up a form for that very easily. And that provides the sort of two-way communication you likely want without, while still having appropriate restrictions in place for what sort of questions can be asked.
So we do have, we've had a couple of people just ask if they can go offline, and certainly I encourage you to please do reach out to, if you go to the telesales address on your screen right now, they will connect you with Adam, who can walk you through a really customized demo to show you and do a deep dive on the piece of the product that you're interested in, whether that's, you know, seeing how surveys work, or getting just a further look at our form options. He can cover all that off. So please do reach out and set up a time for one-on-one. So Patrick, I do think that's the end of the questions that we've got. Oh wait, there was one I missed around hardware. So kiosks and tablets. The question was, is the hardware included, or is that a separate cost? You purchase your own hardware is the answer. We run on Android, and fortunately, Android offers, particularly in the Samsung line, you can get a really, really strong, really nice tablet for about $300. So hardware is a separate cost, and it's a one-time cost, but you own it. Also, TELUS does resell those items, so you can actually get a quote directly from TELUS on all of that.
Just one last question, too. There's a question about how our online booking differs. I would. Yeah. Okay. Yeah. So just to recap, in case anyone missed it, I think the key features are no patient login or password required, extreme configurability when combined with our forms engine. So it's such a seamless integration with the other components of the Ocean library to allow you to get the information you need. It's almost like a line of not defense. It gives you the clinical information you need right from the get-go, so that your staff doesn't have to spend valuable time trying to obtain that information. So I think we're really proud of Ocean's ability to communicate with patients and get the information you need as part of a single unified platform.
All right. Well, Patrick, I think that's time, and also we've run out of questions.
Excellent. That's great. And thanks again, Victoria, Adam, and Doug for a great session. It was very informative. The webinar has been recorded, and we will share it with everybody early next week. And I'll just remind everybody, if you do have any questions, feel free to reach out to your TELUS Health account managers. And once again, thanks again, and have a great evening, everybody. Thank you, guys.
Thank you very much.
Thank you, Patrick.
Thanks for your time.